much for being here, and we're excited about talking about better data for better healthcare. I'm Dr. Hansa Bhargava. I'm Chief Medical Officer at Medscape Education, and I'm also a board-certified clinician pediatrician. So today we have a great panel. Before we start, though, I just wanted to ask everyone who in this room actually feels comfortable with knowing what artificial intelligence is and its impact on healthcare. Just a show of hands would be great. Great, and for those who have raised their hands, who actually feels comfortable about how that actually parses out into machine learning and other sub-areas of artificial intelligence? Great, okay. So I just wanted to start level set and talk a little bit about the end user, which is why we're all here today, right? To better health. So interestingly, today, in a survey that was released by the American Medical Association on digital health and digital health uptake of clinicians, 93% actually feel like they are interested in data-driven analytics, artificial intelligence, and digital. 1 in 5 clinicians are actually adopting it right now into their workflow, and 2 in 5 say that they intend to adopt it in the next 18 to 24 months. This actually could be very helpful to us. Of course, we need to be very aware of strategies and also biases and make sure that we take a very equitable approach to using artificial intelligence to better our healthcare. So whether it's the patient, whether it's the hospital, whether it's the healthcare industry, whether it's data, whether it's public health, AI could absolutely help and benefit us to get better. And with that, I'm going to turn over to our amazing panel here and let them introduce themselves. Jim, we'll start with you.
Thank you. Good afternoon. I'm Jim Forbes, Head of Strategy for Vizia Technologies. We provide real-time data analytics to hospitals, including locally Emory, Grady, Piedmont, and last week we announced CHOA, Children's Healthcare of Atlanta.
Hi, I'm Charlie Kemp. I'm an associate professor with tenure in the Department of Biomedical Engineering at Georgia Tech and Emory, but I'm also co-founder and chief technology officer of Hello Robot. And my work focuses on robots with wheels and arms and how those can help people in healthcare.
Hi everyone, my name is Mark Michalski. I'm the worldwide head of AI and ML BD for healthcare and life sciences. I'm a board-certified radiologist, so glad to have another clinician on the panel. I'm glad that we actually have some real technologists in the middle here to keep us on track, so good to meet all of you.
Thank you so much. So let's just start with the first question that I'm going to toss over to all of you, and I'll just point out that this is a collaborative effort, right? With different areas represented, which is what this conference is all about. So the first question, which I asked to the audience is, what do you know about AI and what does it mean to each of you in terms of the impact on healthcare? So we'll start with you, Mark.
Yeah, so AI is kind of a little bit of a dubious term these days, for better or worse. I tend to think about the world sort of AI as sort of a subset of machine learning, and machine learning is really just a set of statistical tools, right? So what it means for healthcare, well, I think that's what this panel discussion is going to be a lot about, but I think fundamentally it's about improving the workflows and the products that we use every day in healthcare, whether you're a payer, provider, an ISV. I think that the technology that empowers those products and services that leverage AI and ML will become better in ways that we may or may not appreciate today.
Great. And Charlie?
I think of AI, artificial intelligence, as a set of technologies, and it's a fascinating set of technologies where there's just an enormous amount of change happening rapidly right now that enable or can enable humans and machines to work better together by giving machines these new abilities.
And Jim?
I'm going to put it a little bit in perspective that in healthcare, there's now 120 million devices in hospitals that are all IoT enabled. They are generating just a phenomenal amount of data. And the challenge is that clinicians are drowning in data. And so I view AI, artificial intelligence, as just a really useful tool that can quickly scan and look for patterns, because that's what doctors do. They look for patterns, and therefore by quickly synthesizing all that data, it can enable clinicians to have better information quicker.
Well, that's great level setting, and appreciate all of your opinions about AI, and definitely, I obviously agree with all of that. So I'm going to get a little bit granular because, AI, it can be defined in so many comprehensive ways. But the question is, how does it actually help the end user? And the end user could be the patient, it could be the hospital, it could be the workflow of the hospital, it could be policy, it could be, public health. So, Jim, let me ask you this. We know AI has been helpful for hospital administration, such as IT, finance. How can it be used for patient workflow?
Right, thanks. Just on the administration side, that represents about a third of healthcare expenses. And so it's been very useful for finance and HR and those types of applications. But we think about patient workflows, how that can be used. A great example is I think about our fabulous facility that we have here in downtown of the Marcus Stroke and Neuroscience Center at Grady. And so we're installed there, and we had a clinician that asked us, could we help them identify what's happening in the stroke patient's physical pathway in a hospital, and how can they debottle those types of challenges of where that patient is with data, all trying to give that clinician a quicker readout on what they're looking for, which is door-to-needle time. And so we spent months working with and interviewing the doctors, the nurses, the med techs at the stroke center, and walking with them and shadowing them. And we kept on working with the lead clinician on a application that we came up with called StrokeStat. And what that does now is it tracks a patient in the hospital in real time where they are, and through a set of sophisticated algorithms, it will send alert notifications to the rest of the stroke team of who's coming, where are they, and what do they need to do next to make that go, no-go decision on the injection of the TPA drug.
That's great. And just in terms of that specific case, Jim, is there advantages to actually addressing disparities with the data? How can it actually help with rural healthcare, for example?
Right. So, it was mentioned by the FDA commissioner this morning about here we are in the South, which is also known as the stroke belt, and access to care in rural communities. And so what a lot of our rural communities lack is the skills that Mark has as a clinician, a radiologist, and the ability to read x-rays and MRIs. Typically, it takes about a half hour for a neuroradiologist to read film and to discern whether or not what type of a stroke that is, where it is, and what would be the protocol for the clinician in dealing with a stroke patient. So what's really fascinating is that another doctor, Chris Manzi, who's a neurosurgeon, he went ahead and he worked long and hard with data scientists to say, how can we find patterns in all of the imaging? And he came up with an application which, amusingly, their company is called Viz.ai, and it's one of the early adopters of utilizing artificial intelligence to quickly scan these images. And what they've been able to do now is compress from what took a half hour, 30 minutes, down to 30 seconds of detecting what type of stroke it is, where the stroke is. And that is all being done, by the way, hosted in the cloud at AWS, which is HIPAA and high trust, so that now you can have a rural community that can have better access to decision-making to care for stroke patients, and it's having a real impact on patients' lives. And there's been so many use cases from it now that the FDA has approved this use around the country.
That's really exciting because we know that one of the areas of disparity right here in our home state are the rural communities of Georgia, right? And, you know, not just the specialists, but even the primary care providers seem to be deficient in certain counties. I know as a pediatrician, there's over 100 counties that don't have a pediatrician, or over 150 counties that don't have an OBGYN. So it really does make a difference when you can get that expertise, especially in a time-restricted case, such as using TPA in strokes. So let me ask you, Mark, a devil's advocate question. So, and a lot of, I'm so sorry to put you on. But here's the thing, like, and a lot of clinicians say this to me, well, that's great and good, but how do I know that there's privacy?
Yeah, what an important question, because we as clinicians, one of our the primary oath that we all take, right, when we start is do no harm. And when we're using these AI, ML solutions, how do we make sure that we're doing no harm by protecting that data? And while trying not to slow down innovation, right? That's the balance that we're all trying to strike here. So from a privacy and protection perspective, I think that we're still in a world, I think, where we're exploring how to do a lot of this safely. Now, there are some technology solutions that allow us to make advancements and to find ways to make sure that data that finds its way outside the walls of a healthcare provider system maintains safety and security by encryption and through some other more technical approaches like federated learning, homomorphic encryptions. But what I would probably say at the end of the day is it still is incumbent upon providers and the solution providers in this space to make sure that number one, that data remains secure, remains safe, and that's a vigilance issue. That's a vigilance requirement that anyone who's getting into healthcare at this point has. So there's no silver bullet. We still have to maintain that vigilance. The good news is that some technologies are making it maybe more possible for us to maintain that vigilance in a way that that's more permissive. That's more that allows your IT infrastructure your IT experts and your SecOps people to advance the progress of AI and ML.
Yeah, I totally agree. I think that's something that we always have to be concerned with, and patient privacy. But then on the other hand, now we have electronic medical records. There's a lot of data, right? And so this is the future, but we still have to have the guardrails for sure. Absolutely. Charlie, I wanted to ask you a question. You've done some great work with your robotics, and robotics have a significant impact in certain areas of health, such as surgeries, we know that, prosthetics. Can you tell me a little bit about the work that you're doing and how it brings it down to the patient level?
Yeah, sure. To be clear, I'm at this. It's an emerging technology I'm working with. There's a long ways to go to benefit people, but overall, the goal is to, for example, empower people with disabilities to do things for themselves with a robot body. And in this case, it's a robot that's about human height, and it has wheels, and it can roll around, but it also has an arm, and it can manipulate things. And with that, I'm really optimistic about the future of what the technology can do, because I've seen in research just the benefits it gives. So, for example, there's Henry Evans and Jane Evans. Henry has severe motor impairments from a brainstem stroke when he was fairly young that unfortunately robbed him of the ability to move his body and do things that able-bodied people take for granted, like just scratch an itch. And so through the robot, he's been able to do these things for himself. He's been able to feed himself for the first time in years. He's been able to scratch that itch. He's been able to pull up a blanket. These things that once you lose them, you all of a sudden realize just how important they are. And then, of course, there's this other side to that. Jane, his wife and primary caregiver, the robot provides this opportunity to reduce the burden on her, and for the robot to do things like clean up the house, or even Henry has used the robot to help do some cleaning in the house. So I think that's, long-term, super exciting prospect, but there are other areas in healthcare where it can make a difference as well.
Yeah, I thought that was really exciting. I mean, as we move to having patients getting more care at home, whether it's using technology for remote monitoring or technology to help those who are disabled, that's very exciting. In fact, didn't Henry also deliver a rose to Jane?
Yeah, I think that's, and I've got to give credit also there because V. Wen, who is this amazing occupational therapist, she just deployed out there with the robot. There were no roboticists on site. It was just Henry, Jane, and V to explore what was possible. And V saw something that in my lab, after having worked on this sort of stuff for over a decade, just had never seen, which is that the robot not only can help in these physical tasks, but the robot can actually help on the social side of things and make a really powerful impact. And in this case, it enabled Henry to surprise his wife with a rose and hand it out to her. And it just was a powerful moment, and it really made this important social connection between them. And I just had never imagined the technology being used in that way.
Yeah. So, I mean, that's a lot, not just the health, but also the emotional wellness, the mental wellness. So many parameters. So, very exciting. And, I'd love to meet that robot, Charlie.
Well, come to my home.
Could you arrange that?
Yeah, I could.
So I'm going to dive into my clinical background a little bit here just for the next question. And that, I did work in one of the urgent care centers at Children's Healthcare for a very long time as a medical director. And we saw over 30,000 patients a year. And I was telling Jim when we were talking previously that part of my job was actually to look at patterns. How many patients came in between the 8 to 9 hour, between the 9 to 10 hour, and how many patients were coming in certain seasons, such as flu season, in the winter. And so part of my job was literally to look at those patterns by hand because I needed to figure out the staffing in terms of doctors and nurses. So now that we have AI capabilities, can you tell us a little bit, Jim, about how hospitals and outpatient centers can actually be helped with this technology?
There are several, ways that you can go about it. You start off with, step one is identifying the problem. So you're going through charts, you're looking for patterns, and so once you've built that thesis, you can then do a set of programs where you're utilizing computer science that can quickly go through and help assimilate more of those types of case studies to affirm what it is that you're suspecting. Then from that, you can now apply that to real-time data so that now when someone comes in, you can quickly have the information available as to how to best treat them. But really, what's going to be powerful is the next step that you can take AI with clinical information, and that is predictive analytics, where now you've taken what's occurred in the past, what's happening today in the present, and then you can apply that to a patient that might be coming in, depending upon their background and other issues that they're having, that the AI can quickly highlight what might be happening next for them if they are on the verge of sepsis or if they're on the verge of being a candidate for diabetes or for heart attack, that you can now have a better indice of what that might be on a predictive basis, and that's the power. But again, it's key to keep in mind that all of this is information that's being given to the clinician. It's empowering the clinician. So there's no abstract data that's making decisions on its own. It's just simply presenting it to the clinician in a much quicker fashion, but ultimately it is up to the clinician to make that final go, no-go decision.
Thank you for that. And just in terms of the clinician, I'm just going to talk to Mark here for a second in terms of solutions, because now one of the big issues, one of the significant issues that hospitals are struggling with right now is actually retention. And sadly, There's a large part of the clinical workforce that is predicted to leave in the next 4 or 5 years. In fact, we're already seeing that Atlanta Medical Center closed, unfortunately, recently, which is going to put a lot of strain on the Grady health system. So, Mark, with that background, like, how could AI actually help our clinicians in terms of their workflow?
I'm optimistic that it can. I think in a lot of ways it's imperative that it does. If you look at the convergence of macro trends, both in our industry and more broadly, from the demographic perspective, we really have to find a solution here. And the good news is that we are finding technology solutions that might be able to fill some of that gap. We've already talked about some in the radiology world, in the imaging world. What a lot of healthcare is about human interaction and then recording those interactions in a way that others can interpret. So it turns out that when AI and ML really became had a lot of buzz, it was really around computer vision. But these days it's a lot of voice and natural language processing, because that's what a lot of caregivers, nurses, physicians, they do on a day-to-day basis. For example, at AWS, we've worked with Houston Methodist through a partner, Paraveda, to work on some solutions at the pre-op, operative, and post-op settings to enable surgeons and surgical nurses to document some of the work that they're doing through voice. And I think that's a really exciting place. A lot of technology development that still has to take place, candidly, but I think that's an area where I would keep some focus on in the next couple of years.
So it could be that AI is almost augmented intelligence.
Yeah, and we oftentimes, I think both of us probably get this question a lot, whereas, is this going to replace us? Is it going to replace us as physicians? And I think the reality is anyone who's working on this technology today recognizes that it really is an augmentation technology.
Yeah, I do get that question a lot.
Yeah,
I'm sure you do as well.
Yeah.
One thing we've learned from the pandemic is that you can't really replace the human connection, right? I mean, so yeah, and as a physician myself, gosh, I was talking to you about, those cases that you see that you don't see very often. Wouldn't it be great to have like some sort of AI algorithm that could actually use predictive analytics to say, hey, this patient is this likely to have this because of these symptoms, of course, in the workflow, and letting the clinician decide at the very end. So one of the other questions that come up is really AI and its pitfalls. So Charlie, let me turn to you and ask you, like, are there pitfalls? I mean, everything has pitfalls. Do you see any pitfalls with AI?
Well, yes. I guess I think that what I would want to emphasize is just right now what I consider to be a real challenge, which is that, first of all, the technology really is able to do new, amazing things. But it's changing so fast, and there is so much hype around it, that it's hard to really interpret and figure out where is it actually going to be useful, and where is it not really ready yet, and it's more, we're just sort of imagining what it can do. And I think one of the risks associated with AI is there's a tendency that when someone sees AI do something, they imagine that, oh, it's like a person can do it. So if a person does that, all of a sudden you expect that they can do all these other things too. But artificial intelligence is very different from human intelligence. And there's this phenomena, for example, where if you go and you show all this data to the AI, and then you ask it to do something that's kind of outside of that data, it can fail in very surprising ways. In ways that you wouldn't expect, because you're like, well, look, if I saw all that, then I would obviously be able to do this too. So I think part of it is we can expect too much of it. And then another risk is that because it's so dependent on what it's seen, it can reflect biases that exist. It's not magic, and so you really have to be skeptical of it, so you don't end up perpetuating something that you really were hoping to kind of get rid of with some false notion that it's this objective thing.
Yeah, absolutely. And, again, guardrails. So privacy is one of the guardrails. And the data that you feed the AI algorithm is what it's going to base its decisions on. So if you, and I'll just talk about research for a second, like there is a paucity of data, for example, of children in research trials, of women in research trials. So if you fed the AI just the data from those research trials, then you're not really getting the data on women and children, for example, right? And so the diversity of data and lots of data becomes really important in AI algorithms. Would you all agree with that?
Yes.
Jim, let me ask you a question. The pandemic highlighted challenges that hospitals are facing with nursing, with medical supplies. Has AI been useful in navigating that?
It has, and this morning the CEO of Piedmont talked about how they spent $400 million last year on nursing due to the pandemic, and how that's been just a phenomenal cost to the health system, and that is not unique, but it certainly is an eye-popping number. And so how we're using algorithms is to help track high-value medical equipment inside of hospitals, so respirators, ventilators, ICU beds, crash carts, IV pumps. So we have sophisticated sensors that can use algorithms as to tracking not only where these devices are, but then giving workflow to the med techs, to other people in the hospital that need to do what they do to make sure that those supplies are there when the nurses need it, because the nursing staff is, they're stretched thin, they're dealing with a lot of patients. They want to give quality patient care, but they spend on average about a half hour per shift looking for medical equipment. And so we're able to shrink that down to let other people in the supply chain within the hospital know that equipment needs to be replenished, needs to be restocked, so that the nurse has confidence when they go to the clean supply room that the materials, the supplies that they're looking for are there. So that way they're able to give better care to their customers. The nurses are happy, and we all know with happy nurses, we have happy patients. But interestingly, the CFO is pleased as well, because previously what they would be doing is just simply renting more and more pieces of equipment, ordering up 100 IV pumps at a time. And once that goes into a healthcare system, it goes into different parts of the building, it goes into ambulances, it gets transferred to other facilities and clinics, and they're not able to keep track of all of these devices that I was talking about. The average bed has about 12 devices attached to it. They're all expensive, they're all mobile, and they take a life of its own. And so that's the problem that we're using algorithms to solve. Where is it, and what needs to be done in the supply chain that can optimize it? And so luckily there's been good results from that. Piedmont has saved $2 million in hard costs on equipment, and then hundreds of thousands of man hours of staff not looking for equipment.
So important to streamline and make processes efficient, especially for the financial health of our hospitals and health institutions. So I have a question. We have been struggling with the pandemic for several years now, and it's so interesting because some people end up having COVID, some people end up having long COVID, but I have a question for anybody who wants to answer this. Could we use predictive analytics to actually figure out who's more likely to have long COVID? I'll ask you, Mark, the clinician.
All right, so I will just say what I know,
Sure.
which is that
Just your opinion.
so we've been able to one very interesting project coming out of UCSD, and they did this early. They did an early predictive algorithm to determine when we didn't have the availability that we have today for low-cost point-of-care diagnostics. They were able to use deep learning as a mechanism for determining COVID versus or predicting COVID versus non-COVID pneumonia, which is a powerful diagnostic at that time. If we believe that we can start to see things from a diagnostic vantage point, when we start to do all the sampling that we're increasingly doing for personalized health care, if we believe that there's a signal in there that will help us determine and differentiate between COVID and non-COVID, then I think that's true. And I'll answer finally in this way. We've never been in a better position to make that determination.
Yeah.
So hopeful again that we might be able to do that.
It's really interesting because a few years back when I worked with WebMD, we had a flu tool, like
Uh-huh.
to figure out whether you had the flu, and this is true. Interestingly, we were always able to predict the flu pandemic for the CDC,
Yep.
Huh.
just by people actually putting in symptoms and using some very basic AI technologies at that point. So I do believe that there's a lot of power there for that. Well, we are almost out of time, so I will ask the question that I know that Russ will be proud of me for asking, wherever he is, and that is, as we move forward, and there's so much capability, so much good that we could do with efficiency and patient care and always keeping the patient as our North Star. How can we use connection and collaboration to do that? So who would like to take that? I'll let
Yeah.
Jim take that one.
So thanks. Collaboration. We're blessed here in Atlanta with a robust healthcare IT ecosystem. And so I'm finding and coming across all sorts of great examples of collaboration all the time. But I really love it when a doctor grabs me and says, hey, I have this thesis, could you help me? And we collaborate with them, and then if need be, we bring in other people. So right now, I'm working with Dr. Cedric Truss. He's the head of health informatics at Georgia State University. We're collaborating on a project with his grad students looking at the data that we're generating from Grady Memorial Hospital downtown. And then we're also working on another project with Providence Mission Hospital in Mission Viejo, Southern California. We've collected a treasure trove of data there, and so we're now collaborating with a group of data scientists called Electrify, and what we're looking to do is mining to find out what are the unknown unknowns that are hidden in that data, because we want to get much better at predictiveness of what's going to be happening in terms of scheduled procedures, census data, just-in-time inventory, so that we can all be better at process improvement. So, collaboration is everywhere. It's just very easy to have a conversation with a clinician and ask them what's keeping them up at night. They will readily tell you.
Excellent. Charlie.
Yeah, I would just say, so I'm in an emerging technology, and for this emerging technology, and I would imagine for emerging technologies in general, I truly believe in the power of working with diverse stakeholders early. The people you want to benefit from the technology eventually, work with them early, because they will surprise you with how they change your thinking, and they change the trajectory of the technology. As an example, the robot that this company is selling, it came out of my lab's research with amazing people like Henry and Jane, and they just influenced that technology deeply. You can see it from the very beginning, and because of that, now there's this robotics platform that's being sold that is inclusive, that people can use, to explore the future. And I don't think it would have happened if my lab hadn't made this priority of working with stakeholders and people early.
Working with stakeholders, absolutely. Mark?
Yeah, it's a really good question. So one of the cultural tenets of Amazon is to be the world's most customer-centric company. That's one of the core foundational principles. In healthcare, in particular, it's oftentimes hard to know who the customer is. Every customer, if you're talking about patients, it's a really multifaceted question about how to determine that voice of customer. Same for clinicians and any professional in the care environment. So the notion of collaboration and connectivity is essential to getting to that root question. What does the customer need? What does the patient need? What does the physician need? that has to be at the center of every discussion about how to not only build a AI and ML product or service, but a product or service, period, in our industry. So that connectivity, that open communication, I think, is really essential for that reason.
Absolutely, and it is really about having different perspectives, almost cognitive diversity, I guess, at the table, because everyone has a different view, and then you get the 360 view by having everyone at the table. Well, thank you all for this great discussion. It is about the we, not the me. I think that's the whole point of this conference, and we're so excited to have had this opportunity to talk to all of you. Hopefully, you'll be available for a few minutes if anyone has questions. But thank you so much, and please go ahead and use our social media handles, and Jim suggested those, so #HCSAI, right, right, Jim?
Right.
But thank you.
Thank you, Hansa.
Thanks, Hansa.